Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A very important study was published in the Journal of Nutrition in June of 2019. The study, known as the Women's Health Initiative Dietary Modification Trial, followed almost 49,000 healthy postmenopausal women aged 50 to 79 years old who originally had a diet whereby at least 32% of their daily calories were coming from fat, which is the typical North American high-fat diet that most North Americans follow. The participants were randomly divided into two groups at the outset of the study, whereby one group now was going to follow a low-fat diet where only 20% of calories from their daily intake came from fat, and the other group was left to keep following the typical high-fat North American diet. So they followed them for many years. At the 19-year follow-up mark, the results showed that women who had been following the low-fat dietary program had a 16% reduced risk of dying from breast cancer and a 13% reduction in risk of developing diabetes requiring insulin and related heart disease risks that go with diabetes, compared to women who continued to follow the typical high-fat North American diet. The researchers conclude, I quote, "Reduction in dietary fat with corresponding increase in vegetables, fruit, and grains led to benefits related to breast cancer, coronary heart disease, and diabetes without adverse effects among healthy postmenopausal women." Now, this is a very important message in today's world of confusing dietary recommendations and constantly emerging fad nutrition and diet plans. Every week there's something new, from the keto diet to the different types of approaches that where all these great claims are being touted. Over many years, the research has continued to support the fact that consumption of bad fats and too much fat in general is a major contributing factor to the development of cancer, high cholesterol, heart disease, obesity, type 2 diabetes, and other health problems. I've worked with many patients over the years, encouraging them to get their consumption of daily dietary fat consumption down to 20% or less of their total caloric intake each day. And when they follow that advice, inevitably, I will tell you that cholesterol drops, their body fat and waist circumference move down towards healthier values, their type 2 diabetes and blood sugar problems are much better controlled and managed. Of course, you can't constantly be eating sugary foods and beverages. This low-fat dietary advice implies that you're also making a reasonable attempt to have healthy choices around carbohydrates and protein foods with a minimal and acceptable amount of cheating, which we all do to some degree. The question is, how do you get your dietary fat intake down to 20% or less of your total daily calories? That's really where it should be. Well, this is how I instruct patients to do it. Eliminate or greatly reduce the intake of the following foods. I've shared this with you before. Most cakes, maybe with the exception of angel food cake, but cake has a lot of fat and bad fats, and especially the frosting of cakes. Donuts and many other pastries like crullers and danishes and cream puffs and chocolate eclairs and pie crust and milk chocolate, anything we've made with milk chocolate like chocolate bars. Even some low-fat muffins. Make sure that the total number of saturated fat grams would be 2 grams or less. So check the labels very carefully on these types of products. Many types of biscuits are high in fat. Pancakes, depending on the ingredients used. French toast, depending on the ingredients being used. All beef and beef products. Red meat has a lot of saturated fat. All pork products, too high in fat. Lamb, very high in fat. Organ meats. Butter and lard, cream and ice cream, any milk or yogurt that's above 1% milk fat, any cheese that's above 3% milk fat, which is almost all the cheeses. Foods containing palm oil, foods that contain coconut oil. There's a lot of even plant-based meat alternative foods that actually have a lot of coconut oil in them, which will raise your cholesterol and make these problems worse or can increase the risk of these health problems that we're talking about here, whether it's breast cancer or obesity or type 2 diabetes. So coconut oil is a problem. Shortenings, you have to look at the labels of breakfast cereals to see how much fat is contained in them. It can vary from one type of cereal to the next. potato chips, cheesies, and the like. It's really better to look for lower fat alternatives like crispy minis and skinny popcorn and low fat fudgicles. And things like this exist in the marketplace. They help to keep fat intake lower even when you're cheating. Remember that a lot of prepackaged popcorns and popcorn that you buy at the movie theater, lots of undesirable fats in there. So a low-fat diet also implies that you're having no cream sauces, no tahini sauce, no creamy salad dressings, and no consumption of mayonnaise. Of course, healthier fats, which you can use in small quantities, would include olive oil and other oils that are high in monounsaturated fat, the use of avocado, eating fish and having some fish oil supplementation maybe at 1,000 to 3,000 milligrams a day. Also flaxseed oil. Nuts and olives are allowed a handful of nuts a day. Be careful with olives that you don't consume too many. And a little bit of peanut butter. Hummus, of course, with chickpeas and sesame seed oil, with olive oil, garlic, lemon juice, and salt. Hummus is a food that has some healthy fats in it that you can have in small quantities. And of course, there's a bit of fat in some allowable low-fat protein foods like chicken breast and turkey breast, Cornish hen, soy products. They have some fat, but it's a minimal amount. And there's virtually no fat in egg whites and beans and peas and whey protein products, which are also a great source of protein. And most fruit and vegetables are virtually fat-free. So I encourage you to work towards getting your total dietary fat intake down to 20% or less and of your total calories that you consume each day. It really is an important proactive strategy that can markedly improve your health profile. That means bring your cholesterol down and help to improve other health parameters. It can help to lower your risk of certain degenerative diseases. And it improves your body shape in a surprisingly short period of time. I'm talking really about a major transformation. If you haven't been applying this principle of getting your total fat calories down, I think you'd be shocked at how much it can change even your body shape in a very short period of time. So good luck with your wellness goals, and thanks for watching. I will see you next time.